Hi, this is Scott Nichols, president of MyMedicareQuestion.com and the MMQ app. We are a proud facilitator of the Medicare Minute, brought to you by the Medicare Rights Center. Here's this month's Medicare benefit information. Original Medicare and Medicare Advantage Standard Appeals. Point 1. Know what to do if you are denied coverage for a healthcare service or item. If you receive a denial from Original Medicare or your Medicare health or drug plan, you have the right to appeal. An appeal is a formal request for review of a decision made by your Original Medicare, Medicare Advantage, or Part D plan. If you were denied coverage for a health service or item, you may appeal the decision. There is more than one level of appeal, and you have the right to continue appealing if you are not successful at the first level. Be aware that at each level there is a separate time frame from when you must file the appeal and when you will receive a decision. Make sure to file each appeal in a timely manner. If there is a reason you cannot submit your appeal within the time frame, see whether you are eligible for a good cause extension. Otherwise, your appeal may not be considered. Keep in mind that an appeal is different from a grievance. A grievance is a formal complaint that you file with your plan. Point 2. Understand how to start a standard appeal for an Original Medicare denial. To find out if Original Medicare has covered or denied the healthcare services you have received, check your Medicare Summary Notice, MSN. The MSN is a summary of healthcare services and items you have received during the previous 3 months. The MSN is not a bill. MSNs contain information about charges billed to Medicare, the amount that Medicare paid, and the amount you are responsible for. If your MSN says that Medicare did not pay for a service and you think it should, call your doctor to make sure that there was not a billing error before appealing. To start your appeal, you should follow the instructions listed on your MSM or redetermination request form. This includes circling the denied service listed and filling out the shaded section at the end of the MSN. Send your appeal to the Medicare Administrative Contractor, MAC, within 120 days of the date on your MSN. The MAC's name and address are listed in the shaded section of your MSN. The MAC should make a decision within 60 days. If your appeal is successful, your service or item will be covered. If your appeal is denied, you can move on to further levels of appeal. Point 3. Understand how to start a pre-service or post-service appeal for a Medicare Advantage plan. Pre-service appeals. If you have a Medicare Advantage plan and you are denied coverage for a health service or item before you receive it, you can appeal to ask the plan to reconsider its decision. Before you start your appeal, you will need to get an official written decision from your plan called a Notice of Denial of Medical Coverage. You can start your appeal by following the instructions on the Notice of Denial of Medical Coverage. Make sure to file your appeal within 60 days of the date of this notice. You will need to send a letter to your plan explaining why you need the service or item. You may also want to ask your doctor to write a letter of support. Your plan should make a decision within 30 days. If your appeal is successful, your service or item will be covered. If your appeal is denied, you can continue on to further levels of appeal. Post-service appeals. If your plan denies coverage for a service or item that you have already received, you can ask your plan to reconsider its decision. You should receive a written notice from your plan stating that it is not covering your health service or item. This can either be an explanation of benefits, EOB, or a notice of denial of payment. This is not a bill. Start your appeal by following the instructions on the notice you received from your plan. File your appeal within 60 days of the date on the notice. Your plan should make a decision within 60 days. If your appeal is successful, your service or item will be covered. If your appeal is denied, you can move on to further levels of appeal. Take action. Call 1-800-MEDICARE for help understanding the cost and coverage rules for original Medicare covered services and items, or request a copy of your Medicare Summary Notice, MSN. Contact your Medicare Advantage plan to learn about cost and coverage of health services and items, or to request a copy of your Explanation of Benefits, EOB. Contact your State Health Insurance Assistance Program, SHIP, if you need help appealing a denial. To contact your SHIP, call 877-839-2675 or visit www.shiptacenter.org. As always, remember, there are great educational videos on your Medicare benefits at mymedicarequestion.com and the MMQ app. And remember, share that MMQ app with a friend. It's free.